To our channel. In this video we are going to discuss about kidneys now. Okay, so kidney is actually located in posterior abdominal wall. Okay, in the posterior abdominal wall, and you know that it is covered only on anterior side by peritoneum. Okay, only on anterior side it has peritoneum, so it is called as retroperitoneal organ. So retro means back side, so it is covered only on the anterior side, and it is retroperitoneal organ because it's back of peritoneum. It is not covered completely by peritoneum, so it is present in posterior abdominal wall. And on each side, if you see on the kidney backs, of course kidney is on the posterior side, so there you will see vertebral column on each side behind, and you will see behind peritoneum. And mainly kidney is useful to remove the waste, so it is a reddish brown structure, so it is mainly bean shaped. And next, coming to the poles, kidney have two poles, so let me draw a kidney. So this is the upper pole, this is the lower pole. Okay, two poles. And if you see the upper pole, it is broad, and if you see the lower pole, it is pointed. Okay, and it has two borders. One is the medial border. How to find the medial border? If you have hilum, then this will be the medial border, and this will be the lateral border. And it has two surfaces. This one, which you can see, this is the anterior surface. If you see the same from posterior backside, then it will be the posterior surface. Okay, so now coming to the surfaces, mainly if you see anterior surface, it is irregular. Why it is irregular? Because there are like many attachments over here, many organs are attached here, so like it is having irregular. Whereas if you see posterior surface, it's flat. So let us write that point. Anterior surface is irregular, posterior surface is flat. Now let us discuss about hilum, like what are the structures which are arranged from anterior to posterior side on hilum. So in the hilum, if you see first from anteriorly, you will have a renal artery. Okay, so sorry, renal vein. So first you will have a renal vein. So let us write them anterior to posterior in the hilum. Okay, first you will have renal vein. Okay, after that you will be having renal artery. Okay, after renal artery you will be having renal pelvis. So this is the order, and this renal pelvis in turn it will expand and end in ureter, right? Expand and end in ureter. So these are the structures which are arranged from anterior to posterior side. So for example, first you will have here you will having renal vein, next you will be having renal artery, next you will be having renal pelvis. So how to remember this? You can remember VAP. Okay, VAP. Let's check out what is the exact location of kidney. So kidney is actually located in epigastrium. Again, let us draw the 9 regions of abdomen. Okay, so if you see kidney, mainly it is located in like this. Okay, so by this diagram you will only say that in which position it's located. So you can see it is present in umbilical region, it is present in left side, right? This is left side, this is right side. Okay, so it is present in left side and right side, on both sides. Lumbar region, it is also present in hypochondrium, and some part also in epigastrium. Okay, so this is the exact location of kidney. And next, coming to, if you see vertically from where it will extend, the upper border will extend from 12th thoracic vertebra to the center of body of 3rd lumbar vertebra. So it is extending from T12. So for example, like this, so T12 vertebra, and also down you will be having lumbar vertebra L1. Okay, so T1 to L3, T1 to L3, this is the extent of kidneys. And if you observe the right and left kidney, especially the right kidney is lower than the left kidney. So you can see the right kidney, this is right side, this is left side. Okay, so right kidney, if you see, it's somewhat lower, but if you see the left kidney, it is higher. So remember, left kidney is somewhat in higher position when compared with the right kidney. So this thing you need to remember. Next, coming to, so now let us discuss about anterior relations of kidney. So for that, let us draw two kidneys. Okay, on the right side and left side. Here you'll have hilum. Okay, so let us divide the kidney. Actually this is right side, this is left side. So right side kidney is divided into 5 parts, left side kidney is divided into 6 parts. So what are those? Let us draw it. So like this. Okay, and this side. So you can see here 1 2 3 4 5. So right side 5 parts, left side 1 2 3 4 5 6. Okay, 6 parts. So now let us start naming. Actually first let us understand the common parts. So what are common here on the right side and left side of the kidney? So first one which is common is the suprarenal area. Okay, suprarenal area. So this is common both in right side and left side. So let us write here suprarenal. This is common. And next thing which is common is here. This is the jejunal area. This is jejunal area. Okay. So this is also common in both kidney. And next thing which is you are having is colic area. So this is colic. Even this is colic. So colic. Okay, so remaining in the right side of kidney 2 parts are unique for this, and here 3 parts are unique for the left kidney. So what are those? Let us see. First will come with right kidney. In the right kidney this is called as hepatic area. Okay, this is hepatic area and this is duodenal area. So these are unique. So let us write here unique. Let us write here right, let us write here left. So on the right side unique is hepatic plus duodenal. And now let us see what are unique in left side. In left side the unique one is splenic area. This is splenic area and this is pancreatic area. And this is gastric area. So left side unique are gastric, pancreatic and splenic. So now you need to understand why right side you are having hepatic duodenal, because especially on right side only you will have your liver, right? So that's why right side. On the left side why you are having pancreatic and splenic, because pancreas and spleen are present only on left side, right? So gastric, here on the left side you will get gastric and here on the right side you will get duodenal. Okay, so that you need to remember. So common thing are suprarenal, jejunal, colic. Okay, so remaining unique for the right are hepatic, duodenal. For the left are gastric, pancreatic, splenic. Okay, so like this you should remember. So this is the anterior relation of kidney. Now let us discuss the posterior relations of kidney. Okay, so in the posterior relations you have, so let me draw the diagram. Okay, so in the posterior relations first you should draw here one ligament. This is the medial arcuate ligament. Okay, first you should draw medial arcuate ligament, and this is a lateral arcuate ligament. Okay, same lateral arcuate ligament, medial arcuate ligament, and here you will have your diaphragm. So of course on posterior side of kidney you will have diaphragm and you will have your lateral and medial arcuate ligaments, and this is the site for 12th rib. Okay, and you will be having different muscles attached, like here you will be having psoas major muscle attached, and here you will be having quadratus lumborum muscle which is attached over here. Okay, and here you will be having transverse abdominis muscle. Okay, and you are having even subcostal vessels and now, because you can see here this is a 12th rib. If there is a 12th rib, below 12th rib, if you remember in thorax anatomy, below 12th rib you will be having subcostal vessels, that is subcostal artery and vein, and also a subcostal nerve. Okay, so along with this there are also three nerves. So what are those? 1, 2, 3. That is first one, as we discussed, that is a subcostal vessels and nerves, and the second one, this is the ilio hypogastric nerve. Okay, and the next one you have here is ilio-inguinal nerve. So these are all the posterior relations, but one thing you need to remember, this is posterior relation of right kidney. As it is a right kidney, in the posterior relation you have only 12th rib, but okay, 12th rib, but the same, all are same, but in the left kidney there is one thing special, that is there is both 11th and 12th ribs. Why? Because you know that the right kidney is somewhat lower when compared with left kidney, and you know left kidney is higher, so I put this higher arrow mark. As the left kidney is higher, it is having both ribs, 11th and 12th ribs. As the right kidney is lower, it is having only 12th rib. Okay, so this diagram is purely of 12th rib. So this for the 11th rib also it will be, sorry, for the left rib, left kidney also it would be same, but only you will be adding 11th rib over there. Okay, so these are all the posterior relations of kidney. So now let us discuss about the arterial supply. Okay, so what is the arterial supply of kidney? So actually we need to draw a flow chart here. Mainly first renal artery, of course renal artery will supply the kidney, and this renal artery will in turn divide into segmental artery. Okay, actually this segmental arteries are 5 in number. So what are the segmental arteries? For that let us draw a diagram here. So for example, this is a kidney and this is its lateral side. Okay, actually it's a sagittal section. Okay, if you draw a sagittal section of kidney, you can see the 5 segmental arteries. That is, the first one is apical segmental artery, and this is a upper segmental artery, and this is the middle segmental artery, and this is the lower segmental artery, and posteriorly you will have posterior segmental artery. Actually one thing you need to see here is this apical, upper, middle and lower, these are all anterior segmental arteries, and this is a posterior segmental artery. Actually segmental artery is divided into anterior segmental artery and posterior segmental artery, and anterior segmental artery is in turn divided into apical, upper, middle, lower, and the posterior is only posterior. So this is a segmental artery. So first renal artery, it gives 5 segmental arteries. After that you will be going into a lobar artery. Okay, so after the lobar artery you will be going into interlobar artery. Okay, and after interlobar artery you will be going into arcuate artery. After arcuate artery you will be going into interlobular artery. After interlobular artery you will be going into efferent artery. So after efferent it will be going to form the glomerulus. Okay, so this is all the renal artery, segmental artery, lobar artery, interlobar artery, arcuate artery, interlobular, refer the name lobular here. Okay, those are lobar, these are lobular. Okay, after that efferent, after that glomerulus. So now this is all the arterial supply. This is efferent. Efferent means which is going to the kidney. So at the glomerulus it will go to kidney and some blood again should come back, right? So that is the venous supply, that is the same names. So from the glomerulus here you will get the efferent. Okay, after efferent you will get the same names, go from back, that is interlobular vein. Okay, for example, okay, interlobular vein, and again arcuate vein. So just you can go backward: arcuate vein, interlobar vein, lobar vein, segmental vein, renal vein. From the renal vein, finally you can write here, it will go to inferior vena cava. So the renal blood is going to drain into the inferior vena cava. So now let us see what is the lymphatic supply. Lymphatic drainage. It is to the lateral aortic lymph nodes, which are at the level of origin of renal artery. Okay, so where the renal artery origin, there this lymph will go and drain. And next, coming to the nerve supply. So coming to the nerve supply, it is by T10 to L1. Okay, this is sympathetic, and T10 to T12, which is sensory. Okay, so this is about nerve supply. And finally the clinical anatomy. So in the clinical anatomy we have one renal angle. So what is renal angle? Renal angle is between the lower border of T12 to the erector spinae, to upper border of erector spinae. Okay, so from the lower border of T12 to upper angle of erector spinae, there is an angle, and that is called as renal angle. So the next clinical is, if there is any blood rupture from the kidney or pus in the kidney, then it is called as perinephric abscess. This will go to renal fascia, and from there it will go to pelvis. Okay, and next, coming to whenever the kidney is enlarged, then especially when enlarged, lower pole becomes palpable. Lower pole is palpable. Okay, next, coming to common diseases of kidney. So let me show it. Common diseases of kidney: nephritis, pyelonephritis, tuberculosis of kidney, renal stones, tumors. So these are all the common diseases, and common manifestations are renal edema, hypertension, raised blood urea. They indicate suppressed kidney function, renal failure. Kidney transplantation can be done in some selected cases. So by this we completed kidney. So our next topic will be about ureters.